Hello, listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. I'm Anna, and as always, I'm here with the insightful Dr. Kota Reddy. Today, we're continuing our deep dive into the microbiome, focusing on how early life exposures and traditional practices influence gut health. Dr. Reddy, I know this is a topic that combines science, tradition, and even a bit of controversy. What can listeners expect today?
You're absolutely right, Anna. We're exploring a fascinating aspect of gut health, how practices at birth, early exposures to microbes, and even unconventional traditions shape our microbiome and overall health. These are the building blocks for lifelong immunity and disease resistance, and I can't wait to unpack it all.
Let's start at the very beginning, birth. You've talked before about how important the microbiome is in early life. What role does the way a baby is born play in shaping that microbiome?
Great question, Anna. When a baby is born, particularly through vaginal delivery, they're exposed to the mother's vaginal and gut microbes as they pass through the birth canal. This initial exposure seeds the baby's microbiome, introducing beneficial bacteria that play a crucial role in building their immune system and supporting digestion.
So the microbiome is almost like a starter pack for the baby's immune system and overall health?
Exactly. Think of it as the foundation of their microbiome for life. These early bacteria help train the baby's immune system to differentiate between harmful and harmless substances. They also aid in developing the gut barrier, which keeps pathogens out while absorbing essential nutrients.
But not all babies are born vaginally, right? What about C-section deliveries? How does that change things?
That's where things get interesting. Babies born via C-section aren't exposed to their mother's vaginal or gut microbes. Instead, they're often colonized by bacteria from the environment, such as those found in the sterile operating room. This can lead to a microbiome that's less diverse, which research has linked to a higher risk of conditions like allergies, asthma, and even autoimmune disorders later in life.
Wow, that's a huge impact. So what can be done to support the microbiome for babies born via C-section?
One approach that's gaining traction is called vaginal seeding. This involves swabbing the baby with the mother's vaginal fluids immediately after birth to mimic the exposure they would have had during a vaginal delivery. Another emerging practice is introducing maternal fecal microbiota in a highly controlled setting, which has shown promise in clinical trials. Both methods aim to give the baby's microbiome the best possible start.
It's fascinating how much of our health can be influenced right from birth. But what about breastfeeding? I know that plays a role too.
You're absolutely right, Anna. Breastfeeding is like a continuation of the microbiome building process. It provides prebiotics, which are the nutrients that feed beneficial gut bacteria, and live bacteria from the mother. Together, these components help diversify and strengthen the baby's microbiome, supporting everything from digestion to immunity.
This is such an eye-opener, Dr. Reddy. It's incredible how interconnected everything is, even from the moment we're born.
It really is, Anna. And as we'll discuss in the next segment, these early exposures are just the beginning. The environment, traditional practices, and even our modern habits play a huge role in shaping the microbiome throughout life.
I can't wait to dive into that. Listeners, if you're enjoying this conversation, take a moment to hit pause and subscribe to Everyday Health Stories. You'll get notified of new episodes and join a community that's making positive changes, one story at a time. All right, Dr. Reddy, now that we've laid the groundwork for how the microbiome is influenced at birth, let's talk about what happens next. You mentioned earlier that the environment and traditional practices can also shape the microbiome. Can you elaborate on that?
Sure, Anna. Beyond birth, a person's environment plays a significant role in shaping their microbiome. Traditional practices, particularly those in rural or agrarian settings, expose people to a wide variety of beneficial microbes. For instance, people working with soil, manure, or compost are naturally exposed to environmental bacteria, which can colonize the gut and promote microbial diversity.
So, is it safe to say that a less sterile environment can actually be good for our gut health?
In some ways, yes. This ties into what's called the hygiene hypothesis. It suggests that our modern obsession with sterility, things like excessive use of sanitizers, antibiotics, and overly processed foods, has reduced our exposure to beneficial microbes. In rural communities, people often eat food straight from the land, work with animals, and even use natural cleaning methods. All of these practices enhance microbial diversity, which correlates with stronger immunity and lower rates of chronic illnesses like allergies and autoimmune diseases.
That reminds me of some of the examples in the material. There was one about a patient consuming buttermilk exclusively for a month to address abdominal issues. How does something like that work?
That's a fascinating example. Buttermilk is a fermented food rich in probiotics like lactobacillus and bifidobacterium. These beneficial bacteria help restore gut balance, reduce inflammation, and improve the integrity of the gut lining. By consuming buttermilk exclusively, the patient essentially reset their gut microbiome, giving beneficial bacteria the opportunity to outcompete harmful strains. This likely contributed to the resolution of symptoms like bloating and cramping.
It's amazing how something so simple can have such a profound effect. But what about the more unconventional example? Consuming honey mixed with cow dung? That's definitely not something you hear every day.
It's definitely unconventional, but from a microbiome perspective, the idea makes some sense. Cow dung contains a diverse array of microbes, many of which are harmless and potentially beneficial when introduced in a controlled manner. This exposure could increase microbial diversity in the gut, which is critical for immune tolerance and reducing hypersensitivity, like allergies. Honey, on the other hand, acts as a prebiotic, feeding beneficial bacteria.
So, in rural areas, where people are exposed to these natural elements regularly, do they generally have healthier guts?
Yes, they do. Studies have shown that people in rural settings often have more diverse microbiomes compared to those in urban environments. This diversity acts as a buffer against conditions like obesity, diabetes, and inflammation. Traditional diets in these areas also tend to include fermented foods and natural antimicrobials like turmeric and garlic, which further support gut health.
It sounds like rural lifestyles naturally foster a healthy microbiome. Are there specific habits or practices from these settings that urban dwellers can adopt?
Absolutely. Incorporating fermented foods like yogurt, kefir, and pickles into your diet is a great start. Spending more time outdoors, gardening, hiking, or even just walking in nature can expose you to beneficial microbes. Reducing the overuse of sanitizers and antibiotics where possible is another key step.
This is such practical advice, Dr. Reddy. I love how you're bridging traditional wisdom with modern science.
That's the beauty of the microbiome. It's a universal connection between our past, present, and future health.
Dr. Reddy, this conversation has been so eye-opening. We've talked about how birth practices and traditional lifestyles shape the microbiome, but what does all of this mean for someone living in today's urban world?
Great question, Anna. Modern life, with its conveniences, has also brought challenges to maintaining a diverse and healthy microbiome. Things like processed foods, over-sanitized environments, and frequent antibiotic use can disrupt the gut microbiota. But the good news is, we can adopt practices to restore balance and even prevent many chronic conditions.
So, what are the most practical steps people can take to enhance their gut health today?
It starts with diet. Adding fermented foods like yogurt, kimchi, or sauerkraut introduces beneficial bacteria to your gut. Incorporating prebiotic-rich foods like bananas, garlic, and whole grains helps feed those beneficial microbes. Spending time in natural environments, gardening, hiking, or even visiting a farm can also help introduce beneficial microbes.
I love how accessible these suggestions are. For parents listening, what's one thing they can do to give their child the best start for their microbiome?
For new parents, breastfeeding is one of the most effective ways to support a baby's microbiome. It provides beneficial bacteria and prebiotics that help shape the baby's gut health. If breastfeeding isn't an option, selecting formulas that include probiotics can be helpful. Additionally, for C-section babies, parents can discuss options like vaginal seeding with their healthcare provider to mimic natural microbial exposure.
What about the hygiene hypothesis you mentioned earlier? Should people reduce their use of sanitizers and antibacterial products?
Absolutely, but with balance. Basic hygiene practices are essential for preventing disease, but over-sanitizing every surface can strip away beneficial microbes. For example, allowing kids to play outside, get their hands dirty, and interact with pets are great ways to naturally boost their microbial diversity.
This has been such an inspiring discussion, Dr. Reddy. It's amazing how these small, consistent habits can have such a profound impact on our health.
It really is, Anna. The microbiome is a lifelong ally, influencing everything from immunity to mental health. By nurturing it, we're investing in a healthier, more resilient future for ourselves and the next generation.
Listeners, if today's episode resonated with you, share it with someone who might find it helpful. And don't forget to subscribe to Everyday Health Stories. You'll get notified of new episodes, gain access to exclusive content, and join a community dedicated to exploring the science of health and well-being.
And as always, please remember this podcast is for informational purposes only. Always consult your healthcare provider for medical advice. Take care of your microbiome. It's one of the best things you can do for your overall health.
Thank you, Dr. Reddy, and thank you, listeners. Until next time, stay curious and stay healthy.
Take care, everyone.